Hello, welcome to Heart, Lung and Circulation's interview on the special edition on vascular aging. That's our November 2021 cover edition. With me in the virtual studio today are Dr. Rachel Climie.
Hi, Anne.
Hi, Rachel's from the Menzies Institute for Medical Research. Also, Associate Professor Jonathan Maynard.
Hi, Anne. How you going?
From the Murdoch Children's Research Institute, and Associate Professor Salvatore Pepe, also from the Murdoch Children's Research Institute.
Hi, everybody, and please call me Sal.
Thank you, Sal. Thank you all while we settle into this first interview for Heart, Lung and Circulation. So if I can direct the first question to you, Rachel, some of our audience will be unfamiliar with the concept of vascular aging. I understand it's a relatively new concept. Can you explain for our listeners exactly what vascular aging is?
Thanks, Anne. So there's actually no universal definition of vascular aging, but essentially it refers to the deterioration in vascular structure and function that occurs with age. It involves arteriosclerosis and atherosclerosis. And some people who may have been exposed to cardiovascular disease risk factors early on in life may have what we call early vascular aging, whereby their vascular age is higher than their chronological age.
I suspect my age might be higher than my chronological age. But I also noticed when I looked at the number of the type of contributors and the countries they come from, there's a lot of international contributors to this edition. Can you share with us how that came about?
Yeah, sure. So currently vascular age is not routinely measured in clinical practice. And this is potentially a missed opportunity to identify individuals at risk of cardiovascular disease, for example, at an early stage of disease progression. And we've recently established a network of scientists, clinicians, engineers, and industry partners to support the transition of vascular aging research into clinical practice. And this network, VascAgeNet, now includes over 300 collaborators worldwide. And as part of the network, we're hoping to increase awareness and knowledge related to vascular aging across the world. So that's how this special issue really came about.
Thank you so much. We're very excited to have it and to be at this international forefront. Why do you think these contributors and people involved feel vascular aging is important?
That's a good question, Anne. And I guess my view of why I think vascular aging is important is because a measure of vascular age really provides a holistic view of the damage done to the vasculature across the life course. So the exposure of all of those risk factors and the damage that they've done cumulatively on the vasculature. And this is opposed to other more traditional cardiovascular disease risk factors, which really only provide a snapshot in time related to that risk factor. Markers of vascular age are also related to cardiovascular disease and non-cardiovascular disease events and mortality independently of those traditional cardiovascular disease risk factors. So that's why I think it's quite an interesting and exciting area to be researching in.
I can see Sal nodding away there in agreement. So given that we understand why it's important, how can we actually go about measuring vascular age?
So there are many ways to measure biomarkers of vascular aging, and perhaps one of the most robust and well-studied biomarkers is the measure of arterial stiffness. And this measure involves the measurement of the speed at which the pressure wave travels between the carotid and the femoral pulse sites. And the higher the speed, the stiffer the artery. Currently, the measure of arterial stiffness is relatively limited to a research setting though, but with advances in technology, it's becoming more and more possible to measure arterial stiffness using different techniques. But in terms of actually measuring vascular age per se, that's really still undetermined and has been addressed in a number of the papers within this special issue.
So if we agree that vascular age is important and we can measure it, I guess clinicians are interested in what they can do to either reverse it as well as identify it or ameliorate the rate of increase in vascular aging. Is there anything we can do about that?
Yes, absolutely. So we can certainly prevent early vascular aging by adopting a healthy lifestyle. So this involves managing weight, engaging in regular physical activity, consuming a healthy diet with minimal intake of salt, for example, avoiding smoking and excess alcohol consumption, and also managing stress levels as well. So all of these factors, if we can maintain this healthy lifestyle, then we can certainly prevent early vascular aging.
As I listen to you, a lot of those are lifestyle factors recommended for a lot of conditions. So it's really good to know you get more bang for your buck and that you can see that your vessels are decreasing their aging if nothing else in your body is. So thank you. I feel I've got a good idea of what vascular aging is, why it matters, how to measure it, what I can do to maybe retard it or do the best for my health. And I'm sure other readers would find that interesting for themselves as well as for their families and their patients. If we can switch gears now to the more specifics of the articles in the edition, if I can turn to you, Jonathan, what do you feel as some of the highlight articles in the edition for readers to take a look at?
Thanks, Anne. Yeah, I think that's a tough question because there's so many great articles in there. So there's a lot I could highlight, but I'll just mention two. There's an editorial by Bart Spronk, which highlighted that it's really critically important to recognise that the most commonly used metric of arterial stiffness, which Rachel mentioned before, is pulse wave velocity, and that's blood pressure dependent. So failing to account for that blood pressure dependence can lead to false conclusions when comparing different patient groups. And if it's accounted for in the wrong way, so for example, many people just kind of correct for that using a simple statistical correction, but that can also cause problems in that it can kind of lead to throwing out the baby with the bathwater in terms of the effect of arterial stiffness and whether there's an independent effect of stiffness versus blood pressure. So that editorial is certainly one to look at because it talks about how we can address that, critical methodological issue. A second one I'll mention is by Sarah Hungerford and colleagues, which discussed the fact that in patients with aortic stenosis, ventricular afterload is determined not only by stenosis itself, but also significantly by arterial properties. And that's something that's a bit of a paradigm shift, I guess. I think not just in terms of that localized lesion, but in terms of the overall load that the ventricle sees. And so they provide an overview of methods for quantifying what they call global left ventricular load. And it's suggested that might help characterize patients who may not have a very straightforward kind of profile, such as paradoxical low flow, low gradient stenosis.
Thank you, Jonathan. I can see that there's a lot of nuance and sophistication in this area of research, as well as broadening changing the way that we're thinking about vessels and vessel disease. Sal, have you got some suggestions?
Yes, well, Rachel's certainly already highlighted, the importance of dietary and exercise lifestyle factors in vascular aging. And of course, that's very well recognized for a long time, but it's evolving. And so not surprisingly, there are quite a few papers in this special issue. But one notable one that is really highlighting a whole shift in the science and our understanding is it's a human cohort study that was led by Francine Marks. And this was on the role of gut microbiota. And these basically produce a lot of short-chain fatty acid metabolites, things like acetate and propionate and butyrate, which sound pretty technical, but are actually very important because their potential for a role in arterial stiffness is highlighted by the study. And what they showed was that there were specific microbial taxa which might impact vascular function by these metabolites, particularly by butyrate. And so there are specific sensors and receptors on cells that ultimately change their intracellular signaling, and the downstream pathways of inflammation and other processes are affected by that. And so this might not only influence individual cell function, but ultimately might contribute to differences in cell stiffness and overall vascular stiffness and function. Now, and the other thing that I'd highlight is a paper by, it's a discussion paper by Khrushchev and colleagues. Now, defining aging in specific terms has really been a big area for a long time. It's been hotly contested and debated amongst researchers. You know, how do we really define this? But Khrushchev and colleagues really highlight a big picture idea in that they're trying to reframe aging altogether in the context of new research approaches and technologies. And that's sort of been a feature of most of the papers in our special issue. And so the capacity to advance cardiovascular aging research has really been tied to the advancement and implementation of, you know, quantitative analytical methods, but also network theory, coupled with the physical and molecular science. And so that's been applied to normal development, aging and disease. And it's these factors that really brought together have really allowed us to define or have a better understanding of a concept called robustness and the system's complexity. And that's a little bit different to ideas that we've had in the past with regards to a system vulnerability or frailty. So that's quite a shift. And so I really refer you to have a read of that paper. It's quite complex, but really brings together a lot of these new ideas. But basically they propose that aging, and that's from healthy aging to unhealthy aging, it really involves this robustness, and it's in processes that are independently and significantly affecting the quality of life. And so these can be modified, and that's the whole concept in terms of the future of the research, in that by modifying robustness as such, and how it interacts with chronic diseases, this might affect health span. And a very good example they give is one related to hunter-gatherers. In those systems and traditions, they often don't have any chronic cardiovascular disease, but they don't necessarily live a lot longer than populations from industrialized nations. So it's this sort of late onset of aging and cardiovascular disease at the very end of the lifespan that sort of shows that there are more things going on within this idea of robustness. And so that's really what's needed to be dissected and better understood by future research.
Thank you, Sal. I guess that's a little bit like looking at health versus disease and trying to be as healthy as you possibly can in this concept of resilience as a person and as a body, in a way, to be able to tolerate more than average and find out what those factors are and employ those. So thank you both for nominating some of those highlights. I can see that their editorials, a discussion paper, and some of the original research in the issue. There are also quite a few reviews in the edition, and I know that turning to your own work, Jonathan and Sal have contributed, I think, a systematic review to do with arterial stiffness in congenital heart disease. What were you looking at or looking for when you conducted that review?
Yeah, so what we were doing, we were kind of aware of a number of articles suggesting that patients with repaired congenital heart disease had persistently elevated stiffness, but there hasn't been any systematic reviews in that area. So it was kind of unclear to us how consistent that finding was, whether it only occurred in certain forms of congenital heart disease. So in our review, we found 43 articles in which arterial stiffness was compared between controls and patients, and we looked at 4 conditions, which were aortic coarctation, transposition of the great arteries, tetralogy, and single ventricle constellation, if you like. And what was really striking was that in almost every one of those papers, there was a report of higher arterial stiffness, at least one measure of arterial stiffness in that congenital heart disease group. And sometimes it was quite substantially higher. So that was, overall, it's a kind of concerning finding in the sense that these patients are young, and we know that, if they have elevated stiffness at that age, they're going to be exposed, their heart is going to be exposed to that elevated stiffness and increased load for many years, which could increase their long-term risk profile. So, yeah, it could be quite important in the congenital heart disease area as the focus shifts away from just the short-term survival, because we're doing better and better in that sense. And we're now shifting towards thinking, how can we ensure these patients live a long life with a long and healthy life,
I think a follow-up work from that could go into a future special edition in HLC, which will be about, I think, congenital heart disease and this shift from just management in the pediatric age groups onwards through life. And that would be a great way to see the work continue. Sal, did you want to add to that?
Yeah, well, I guess it's important to emphasize that all these different congenital heart conditions that were covered in the review have greatly differing abnormalities in gene expression, organ development, and their structural and cellular anatomy and chronic disease trajectory are all quite different. That these conditions have a common underpinning of greater vascular wall stress, all of which then impedes normal vascular and cardiac function. So in addition to accurately measuring these dynamics, we need to dissect them down to the underlying molecular mechanisms in the different vascular cell types. So in this issue of heart, lung, and circulation, there was a paper by Veronique Regnault and colleagues, and they overviewed the current understanding of integrin-mediated mechanotransduction in vascular aging. And this is actually a very important molecular clutch system. It's sort of a regulatory system in which smooth muscle cells have active or actin polymerization and contraction and cell migration. These are all very important processes, particularly when it comes to adaptive plasticity and remodeling of the vasculature. So, and they nicely summarize that area. Now, another paper was by Van der Brugge and colleagues, and they actually covered the role of methylglycol. And now this is a highly reactive metabolite that is involved in the formation of advanced glycation end products, which in turn altogether modify cell membranes and the protein function within. Now, the accumulation of these compounds may promote the development of arterial stiffness, and it's through very complex inflammatory and oxidative stress signaling, which is, I guess, networked and certainly has multiple effectors, and but ultimately all play a role in shaping adverse vascular remodeling. And so, again, this is a very interesting and just highlights just one of perhaps many hundreds of compounds that play a role here.
Thanks, Sal. That's really interesting. Another type of article in the issue, we've got one protocol, which is the Youth Vascular Consortium protocol. And this is something Rachel's very involved with. Would you like to speak about that protocol, please, Rachel?
Yeah, sure, Anne, thank you. So the Youth Vascular Consortium is an international collaborative project that has been established to investigate vascular aging from early life. And it's been set up because currently we don't know what is normal vascular aging and what is pathological vascular aging in early life. So that's what this consortium is aiming to determine. We're currently collating data from research groups worldwide. And currently we have over 40 research groups involved in the consortium, and we're hoping to increase that. So if anyone listening is interested in joining, please have a read of the protocol and get in touch with me. We'll be more than happy to welcome any more collaborators to this project.
Thanks, Rachel. That does sound like a very exciting and important project. We're probably ready to sign off this first interview. Would any of you like to add any further thoughts or concluding thoughts?
Oh, just that there's a lot to read.
There is a lot to read.
It's a great issue.
It is.
Yeah, and I'd just like to add my thanks to Heart, Lung and Circulation for supporting us with this special issue and yeah, really supporting us to disseminate knowledge and research, not only on this side of the planet related to vascular ageing, but across the globe. We really couldn't have done it without the support of the team from Heart, Lung and Circulation. So thank you, Anne, and to others involved as well.
I think it was a wonderful experience for all of us at the journal, and I know the journal's editor-in-chief, Professor Robert Dennis, is particularly delighted with this edition and that it's going to be featured hopefully at the Artery meeting, which is later on this month in October. By the time this goes online, the meeting may have been held. So once again, thank you for joining with me today.
Thanks, Anne.
Thank you.
Thanks, Anne.
You're welcome. You've been listening to an interview with Dr. Rachel Climie, Associate Professor Jonathan Maynard and Associate Professor Sal Pepe, the guest editors of Heart, Lung and Circulation special issue on vascular ageing. Listeners may be interested to learn that our publisher Elsevier has granted this issue free access for about 3 months, essentially till the end of 2021. You can access this issue and others at the journal's homepage, recently updated, www.heartlungcirc.org. Thank you for listening.